Are you looking to strengthen your rib cage after you've had a rib injury from jiu-jitsu? Well, we've got you covered for this episode. Hey guys, I'm Dr. Josh. Today's episode is going to be about rib injuries, what you can do to help strengthen them, as well as what you can do to help prevent them. And I'm going to show you some of my top exercises that I use in my office and around here so that I don't get these rib injuries. And if you did suffer them, what you can do to help combat them and get yourself back on the mats as soon as possible. So the first thing that we do after we get an injury, it's really hard because we're not going to talk about the mechanics of the injury, whether you had a pop or a click right here in your rib. The thing is, you need to know that, is it getting worse? Is it getting better? Maybe you need some imaging. Maybe you do not. Well, either way, what we're going to do is, assuming that this injury is not super severe, the first thing you may want to do is start to brace that. Now, we can do this in many ways. We can do this with a band around here. We can hold it a little bit. But one of the best ways to actually do that is to take some taping strips, like kinesio tape or rock tape. I highly recommend because it's a little bit better and it's a little bit more sticky. But what you can do is place it in an asterisk right over that rib cage. And what that does is it adds a little bit of compression to that area, and as a result of that compression, you get a little bit of reduction in some pain, and it helps to stabilize that rib cage artificially so that you can feel better when you're doing things around the house, when you're doing laundry, when you're doing some activity, or maybe when you're trying to engage your core. Again, this is really common because what happens is that when you strain a rib, you destabilize the rib cage, and by taping it, you're going to want to artificially stabilize that so that you can feel a little bit better and reduce the pain. So if you're still dealing with pain and you want to start to mobilize and gain some core strength, one of the easiest and best things to do is diaphragmatic breathing. So basically that is breathing through your rib cage and not through your chest. So to look on the side here, what we're going to do is, instead of breathing like this, taking a big chest breath, like like this, what we're going to do is take a deep breath from our belly. We're going to focus on expansion of our rib cage, expansion of our belly, and core engagement and core bracing. We're not going to go and sloppy. We're going to really focus on breathing up through the ceiling. After we do about 3 breaths, we're going to do belly rise, belly fall, but keeping some sort of contraction within the belly. This is going to help gauge and engage our core without causing any irritation of the rib cage here. Once we do a few repetitions of that, or a few breaths, we're going to end up doing it from the side. I want you to think about breathing out to the side and back, and then trying to fix the ribs in that capacity. Then from this position, I want you to think about going all the way around, up, out to the side, and then all the way out to the side, and then including the back. This way you can fill the entire body cavity and the entire rib cage with air and not worry about flaring out the rib cage. This breathing pattern will help oxygenate the blood and to engage the core so that we can actually start getting back on the mat as soon as possible. So this is really, really important, and this is probably the next step that you're going to start doing after and while you tape it, because if you're in the pain relief stage or you're in a lot of pain and you can't do a lot of stuff, this is also going to be good. As you get more advanced, by the way, when you do that, you're going to start sitting up. Maybe you can do the standing, but start with your back on the mat or back on the floor with your knees bent, and that's the easiest way to start. Assuming you're starting to feel a little bit better and you're starting to want to mobilize the mid-back, you can simply use a foam roller. What we'll do here to mobilize the ribs is we can get some thoracic spine or mid-back movement. We can do stuff like this. We can support our neck and we can extend back. We can even do what I call rib scrubbing, which is where we basically get off to the side. We mobilize this direction and going off to the side. So if I kind of turn my back to you a little bit, we're not at up and down here. We're not 90 degrees. We're not at 45. We're roughly at like 20 degrees off to the side. And we're just kind of getting a little bit of rib mobilization and trying to mobilize the ribs so that they're a little bit more mobile when it comes to jiu-jitsu. Jiu-jitsu is a very dynamic sport, as you know, and there's a lot of pressure on the rib cage. So it's really important not only to work the front of the ribs where they get injured, but to also work the back where they attach, because they do attach to the mid-back, And when you have good spinal posture, when they attach to the ribs, you're going to have good posture not only from the back, but all the way to the front. And this could also alleviate a lot of pressure from the front as well by relieving the back. Also, if you want a little bit more of a aggressive spinal mobilization and you want to focus a little bit more on breath, you can use a little bit of this peanut. And this peanut is really great because what you'll do is you'll put your spine in the middle and you'll really mobilize it there and you'll stay there for a little bit. It's a little bit more tense, it's a little bit more aggressive, but it's something that might be good for you if you're getting to the next phases and you really want to go a little harder. So this is the Gemini tool or a peanut, something that you can do. You could even tape a double ball together or go out there and get a double ball, whatever's easiest for you, but this is just another aggressive or more aggressive way to help mobilize those ribs and that mid back. A couple of my other favorite thoracic spine mobility tools is open book, closed book, and thoracic spine extension and rotation. So what that means is that we can take our foam roller here and we can put it in here. We can open the book and close the book. This might be a little bit easy for some of you, but this might be a good way to get started, especially if you're getting some rib pain or you're trying to avoid some rib pain and keep that mobility. Again, the reason we're doing a lot of mid-back work is because the ribs attach from the front to the back and from the back to the front. Jiu-jitsu is a very dynamic sport. There's a lot of compression to the rib cage, and in addition to that, there's a lot of rotation. So we need to train the body with rotation, and we need to start mobilizing with rotation as well. To show you also what that extension and rotation looks like, this is more aggressive. So what we'll do is we'll place our hands onto the ground. What we're going to do is we're going to elbow through here, and we're going to reach up. There's a lot of different ways that you can do this, but I really like this one. This is a really great one for our posture. We can come back. We can come down a little bit further and peek through the hole. We can do a lot more options where we have some more hip mobility, where we're doing this or we're doing this and we're rotating. But either way, you can see that we're getting a lot of rotation and extension, and we're mobilizing a lot of the mid back and the ribs, and we're also not flaring the ribs. We're really focusing on bracing our core, so we're developing good core strength and good spinal as well as rib mobility. So assuming you're starting to feel much better and you're starting to gain some strength and you want to start gaining abdominal strength, we can start doing bar hangs at 90 degrees. This is going to be super important because this really mimics a lot of guard, and so if we're like this, we can really start to worry about our guard position, our hip strength, the fascia that attaches all the way down here, our abdominal strength, and we can worry about how to breathe in this really difficult position. So if we come up to this bar here, we can just simply hang. It's also going to be really great for our hand grip strength. So instead of just kind of flaring our ribs like this, if you see this, what we're going to do is we're going to tuck our ribs a little bit, bend the knees a little bit, and if you really even want to go, you can even go all the way to 90 degrees, holding here for roughly 30 seconds, and really focusing on core strength and try not to sway back and forth. This is going to be a really great core exercise that helps build strength, and it's really functional for jiu-jitsu. It's going to help lock on and to strengthen that rib cage. Of course, another great exercise that you can start doing that's really functional for jiu-jitsu and to help strengthen the core and the ribs is going to be planks and side planks. The reason I really like those, in addition to something else, is because you can really easily modify. So what we can do is, instead of going into a full side plank like this and maybe injuring ourselves, we can get up into this position and modify and really start to build our strength through that. In addition, when we're in the plank position, we can come here. Instead of coming all the way up, we can drop down to a knee. We can work our way up. And if assuming you're getting strong enough there, what we can do is we can do some low bear positions where we can hover and hold. We could even start to walk. And this is really functional for jiu-jitsu, and it's really specific to our sport. And it's really specific towards building core strength and really locking in those ribs. Remember, when you're doing these exercises, you don't want to be in this position. You don't want to be high up. You really want to make sure that your rib cage and your spine are straight and that you're really locking down those ribs. Remember, we don't want to flare these ribs, and we don't want to hyper compress these ribs, but we're trying to strengthen in a very strong position so that we prevent any rib injuries and any problems happening with their low back in the future. Another great exercise that we can do to help get rotation within the spine and help our obliques and our ribs is called the Pallof press. This exercise is actually great, and I'm going to show you a couple modifications here. First, what we can do is we can get into this position where we're here and we can push out, and the weight of the band is trying to pull us this way, and we're just trying to hold. We're not trying to go this direction because maybe at the beginning it's really difficult to do so, and maybe doing any rotational components might be troublesome. So maybe we have to just hold it here and come out. Also, as we get stronger, we can walk a little further, and again, the more resistance will push us this way, and our goal is to go this direction. Also, if we want to start here, what we could do is we can start rotating and getting strength in that direction, and of course we can do the opposite direction. It's really important that if you're training jiu-jitsu and you're training martial arts and you're doing these types of injuries or trying to prevent these types of injuries, you really do both sides. You don't want to develop a bias towards one side and be really strong on one side. Again, you can't always pick how you train, but if you kind of always go to the right, yeah, you may have to practice a little bit more on one side than the other. But again, jiu-jitsu injuries don't discriminate. It can happen to either side, so we might as well just practice and prevent both sides and really be as strong as we can so that we can stay on the mats as long as possible. To develop a lot more strength within the pulling section and the rotation section, we really want to focus on some sort of pull, right? Jiu-jitsu guard pulls, any type of cross collar pull, any type of arm drag requires a lot of pulling, and then also cutting that corner requires rotation. And if somebody is on our back or we're trying to rotate into them, that's going to cause a lot of strain on our rib cage. And it's really important that not only our arms, our back, but all the ribs are strong too. So what we're going to do is we're going to show you how to gain that type of strength. So what we're going to do here is you can do this standing, you can do this in a kneeling position, but what I like to do is I like to grab here and I like to do a pull, okay? If you notice, I'm not trying to fully open this direction, but I am kind of having a nice stance here and I'm pulling, and again, the weight of here is trying to pull this direction, and it really mimics a type of rotation and a type of functional move that you would see in jiu-jitsu. Again, going on this side. And it's okay to give a little bit of a cheat. So just to give an example, maybe you're on the last rep or two, maybe you want to get a little bit of a movement here, but it's okay to give a little bit of a rotation at the end, but it's not okay to do this every time, right? We don't want to do that. We want to really make sure that we stay nice and strong and develop that rotational strength and that strength within the lat and the arm so that we can cut the corners and so that we don't get injured while doing jiu-jitsu. So one of the final exercises that we can do in jiu-jitsu is a med ball throw. If you think about jiu-jitsu, there's a lot of plyometric, there's a lot of explosive movements. They're again taking the back, turning into people. There's a lot of rotational components. This is very true for wrestling as well. And if we don't start to train explosive, it's going to be a little bit more detrimental to us. So we really need to start bringing ourselves from I got injured to let's do some more gentle stuff to becoming more aggressive and then doing some training all the way through to plyometrics. So what we can do here is we can do med ball throws. We can come across like this. We can start light like this, and then we can eventually develop more power where we're coming in and throwing really hard. You could do a lot of reps. As you can see, this requires a lot of explosiveness, a lot of strength, a lot of power, and a lot of speed, and that's what plyometrics are. So if you watch this video all the way through, you'll notice we started from the easiest exercises all the way to the most advanced. And if you stay there for a little bit, that's okay. If you have to regress a little bit, that's okay. And just give you a little bit of heads up, there are many, many different exercises other than what we showed, but these exercises are something that's going to help you get that rotational strength, stay functional, stay on the mat, and it's going to really help prevent the dynamic things that happen in jiu-jitsu. Again, jiu-jitsu rib injuries are super common. They happen all the time, and it's really important that you take care of them. Obviously, you can do other things like see a soft tissue therapist. That really does help, but if you've been dealing with this a long time and it's just not getting better, these are some of the things that I would highly recommend to do when it comes to getting back on the mats, staying strong, staying healthy, and ultimately, if possible, preventing these injuries from starting off in the first place. So thanks again for watching. I'll see you guys in the next episode. Take care. See you on the mats.